Hi, I'm Dr. Matthew Martin at the Hand and Plastic Surgery Center in Grand Rapids, Michigan. I wanted to take a moment today to discuss a diagnosis known as carpal tunnel syndrome, and it's a process with which undoubtedly many of you are familiar. Carpal tunnel syndrome, as you may know, involves numbness and tingling in the fingers, including the thumb, the index, the middle, and part of the ring finger. It's a condition that affects millions of people. A lot of people experience symptoms at nighttime. They may wake up with a hand that's tingly and numb. People may have symptoms when they're driving. Holding the steering wheel with your hand in kind of a bent position can exacerbate the numbness in the fingers that we discussed. Sometimes holding the phone or sometimes typing at a keyboard can also be issues which will exacerbate the symptoms as well. A lot of our patients will come to us sort of with a diagnosis already in mind, whether it's made by the primary care doctor at a routine visit, or if it's something that maybe you've done some research already on your own at home. And a lot of our patients will have already obtained what's called a nerve conduction test, which is very helpful to us to sort of give a more clear diagnosis and level of severity to the diagnosis of carpal tunnel syndrome, so we can act upon that appropriately. A lot of our patients will also have been counseled by their primary care doctors to trial a splint, whether it's just at night or maybe all the time. A splint would be worn on the wrist and on the base of the palm to kind of keep the wrist in a very neutral position, so there's not that bend to the wrist that can otherwise exacerbate pressure at the carpal tunnel space and cause those symptoms we talked about. So really, what is carpal tunnel syndrome? If you look at it, carpal tunnel syndrome involves what's known as the median nerve. So the median nerve starts on the spinal cord, goes down the arm and into the fingers. And the median nerve here in the carpal tunnel space is about as big as a pencil. And it sends branches that go to the thumb, sends branches that go to the index finger, sends branches that go to the middle finger, and one branch that goes to the ring finger. It should be noted that if you have numbness or tingling in the small finger, it's probably not related to carpal tunnel syndrome. There's some other processes that might lead to that instead. But really, the carpal tunnel syndrome has to do with too much pressure on the median nerve within a space called the carpal tunnel space in the wrist. On either side of the median nerve are some wrist bones, and then along with the median nerve in the carpal tunnel space are the finger flexor tendons. Also, the roof, if you will, of that carpal tunnel space is what's called the transverse carpal ligament, and that's a very stout band of tissue that starts at about the wrist crease and goes up to not quite the mid-palm. And in a lot of folks, that transverse carpal ligament becomes very thick as carpal tunnel syndrome progresses over time. This leads to pressure upon the median nerve, and when the median nerve is experiencing a lot of pressure like that, unfortunately, the nerve fibers that then go to the fingers don't do their job quite as well in conveying sensory signals back to the brain. Another thing that's worth noting is that the median nerve also sends a branch that goes to some of the muscle here in the thumb as well. So that thumb muscle is in part responsible for some pinch function and some grip and grasp. And when some of our patients come to us, they've got carpal tunnel syndrome so advanced that that nerve hasn't been able to send motor firing signals to the muscle that we're talking about, and therefore the muscle can be actually atrophied or wasted away. So how can we affect carpal tunnel syndrome in terms of a surgical treatment? Well, when we talk about carpal tunnel syndrome, once again, it's all about pressure on that median nerve. And so if we can relieve some of that pressure on the median nerve, as hand surgeons, that's what we need to do. And after you've had your nerve conduction testing, often we can tell that you'll be a good candidate for carpal tunnel syndrome. And if that's the case, we may propose carpal tunnel release surgery. This is usually done in an operating room setting. Less likely we may do it here in the office, and that's possible as well. Two main ways to do a carpal tunnel release surgery. The first is what's known as the open carpal tunnel release surgery. That's where you make an incision on the palm, and it's usually about 1.5 inches to 2 inches long. That incision is through the palm skin, and we travel down to where that transverse carpal ligament structure is, and we physically release that transverse carpal ligament directly from the top on down. That gives the median nerve more space and less pressure upon it. We then suture up the skin where we've made our incision and see you back in about 10 days for a post-operative check. Your activities are initially restricted, but then eventually you'll have very little restriction. And in general, in my experience, the open carpal tunnel release recovery is about 4 to 6 weeks for most patients. The other way that we can do a carpal tunnel release surgery is a little newer, called the endoscopic carpal tunnel release. That's where we make an incision right back here at the wrist crease, and that wrist crease incision is only about 1/2 inch long. When we've made that incision, I can then pass what's known as an endoscope down underneath this transverse carpal ligament, right next to that median nerve that we've been discussing. And this endoscope has a camera on the end of it, but then also a cutting head at the end of it. So I can actually pass the endoscope down through that small incision we've made that's, again, off of the palm of the skin of the palm, and then underneath that transverse carpal ligament, and divide the transverse carpal ligament very safely without cutting the median nerve, and achieve the same goal of relieving the pressure upon the median nerve in a little bit less invasive way. After that's done, we put a couple stitches in the skin there, again a soft dressing over the skin, and you're a little bit less restricted after an endoscopic carpal tunnel release, and in general our patients are using their hand as normal in about 3 weeks' time after that procedure. Both are very good. If you suspect that you have carpal tunnel syndrome, you can try some of the things we've discussed. Certainly, I'd urge you to get in touch with your primary care doctor for a referral, or you can always contact us as well. Thank you for your time.